Mr. McNamara.
Thank you, Mr. Warden, and thank you to Mr. Craig, obviously, for his report, which I also, as Mayor Antea, concur wholeheartedly. I just want to add, there's a few comments as well, and one of them that it's in terms of echoing. I'm not going to get into too much, but I know Mr. Hotham, I certainly agree with his comments. The site's been selected and so forth. It is now time for us to really unite and get behind this project. This is probably the single most, I think, important decision that our council will make, I think, in the rest of this term, and certainly for the City of Windsor as well, but it's the right one. It's not just the fact that, it's the two hospitals, we know the professionalism is there, but they just don't have the tool set to be able to deliver 21st century medical care. And if we're going to squabble about where it's going to be, whether it's on County Road 42 or if it's on Lozone Parkway or whatever, I mean, at the end of the day, that to me is a moot point. It's done, and, folks, get on with it. We need to move. Because it's the part that I have the greatest fear is that we could be giving the government an excuse not to build a hospital here. And that, I think our duty to all of our citizens is to make sure that the government can't make that decision. They have to make the right one, which is we're next in line, and we need to build this hospital, because there are 5 others behind us, and some of them are sitting members, and some of them are in cabinet. So you can imagine the influence that they will have on the government in selecting a site. The part that I think we probably shocked the government more than anything is that we've top-loaded the $200 million. Instead of saying, well, we're going to give 30% and we're going to give 40, and we're going to go out to the community and we're going to do some fundraising and we're able to put some dollars together. We didn't. We top-dressed it, got the $200 million, and it doesn't preclude the fact that we can go out and do our fundraising. And obviously the benefit there is that the requirement for the $200 million then decelerates, or whatever you want to talk. But I really, really believe, and for whatever reason, individuals, whether, they keep referring that it should be downtown and so forth, they're getting their hotel dues coming back retrofitted for special services. They're getting a new emergency center in the old Grace site. So it's not that they're abandoning that part of the community itself. But the biggest piece for some of the detractors is the fact that our county, we deserve to be part of accessibility to that hospital. And those buildings that were built 100 years ago, maybe at that time they were at the fringes of whatever that community was. And I'm sure there was probably discussions at that particular time. But we have to remember that the hospital that we're building today, it's for the next 100 years, and realizing where the growth is going to be. And it's ironic that today when I flew over the area, and I actually looked at the site where the new hospital is going to be, and there are a lot of houses there within a few kilometers. And you can see where the growth is continuing to expand. But we need to unite. I know around this table we are, and we're ready to push forward. Nobody likes to increase taxes, but you know what? This is one area where it's easy to say we're going to contribute, because at the end of the day, in 10 years' time, we'll have the proper hospital that's going to service all of our community for years to come, with top-notch facility, and also the ability for us to attract the expertise to continue to innovate on healthcare. You can't do that with old facilities. We're fortunate enough that we've got a beautiful school here that is graduating, doctors to fulfill some of the requirements we have in our area. But I think, the big piece to not only keep them here is to have a center of excellence for healthcare. It's time. We need it. It's our time. We've all paid for all those new hospitals across the province. It's our time that they pay for us to, again, do the right thing for our communities. And I fully support the recommendation that's going to be coming forward and supporting this to move forward. Thank you, Mr. Warden.